Good evening. I'm Lodi's Warenstein. I'm president of the Alliance for Health, a nonprofit community convening body throughout West Michigan, where I've been employed now for the last 38 years. This evening, I'm going to be speaking basically as a precursor to the health economics. Hopefully many of you have taken economics. I'm going to bring you back to Adam Smith 101 and talk about what it takes to have a free market, for the simple reason that a lot of the discussion that goes on politically is wrapped in emotional terms about free market, competition, laissez-faire versus regulation, and I hope I'll be able to challenge a couple of your assumptions. We as Americans generally are taught to rely on a free market, an open system, an economic system that has its roots in the teachings of Adam Smith. In order to have a free market, you need 5 characteristics. If you have those, you will have a system where supply and demand are balanced, costs are held in line, and there's great competition for your business by people wanting to give you the best product at the lowest price. And we believe in that as a system. That's largely the fundamentals behind capitalism. So you got to take a look at what those characteristics are. The first characteristic would suggest that consumers are responsible for the financial consequences of their decisions. They alone make the decisions. They are responsible for those. They weigh the merits of purchases. Do I want a Cadillac or do I want a Hyundai? The second requirement is that buyers are knowledgeable, that they really understand what the product they're buying and what the price is. And those are things that can be influenced by advertising. We've got the best, we've got the greatest, our stuff tastes better, and so on. But the buyer has some understanding of price and the relative merits of the product. Third characteristic, you have a large number of sellers in the market so that buyers have a range of choices. The sellers will compete for buyers by offering goods and services. The next area, sellers have to be free to enter or leave a market as a result of financial consequences and financial considerations alone. They can compete, new guys can compete against older ones. If they can't compete effectively, they may have to leave the market. New people who are real successful might cause established sellers to leave the market, but sellers are at risk financially. Also then have to say no single buyer or seller, either side, should be large enough to unilaterally influence price. There should not be monopolies on either the buying or the selling end. And the government role in a free market is simply to prevent monopolies. So let's look at how healthcare stacks up. Consumers bearing the consequences of their decisions. How do they? When they're protected from finances. Insurance, third parties are the primary way to pay. A lot of people don't even associate, if they're working, that the pay that the employer considers includes insurance as well as the wages you take home. If they didn't pay as much in the way of insurance, you might take home more. Insurance is a buffer between individuals and excessive expense. That's what it's intended to be. But a lot of people then don't worry about it. That insurance card is a platinum charge. We talked about the consumer having to bear the consequences of the decision. And the final thing is, in many cases, we don't even make decisions. I'll go to Dr. Olson, and Dr. Olson is going to say, you need a tonsillectomy. And, you know, I can do it, or a friend of mine can do it for you. I'll make the decision for you as the provider as to what ought to be done, and I'm going to thank her for doing that. I talked about having knowledgeable buyers. Well, price and quality information is often lacking. A lot of things happening, and nobody is really going to be able to put it all together to get the total price. Talked about a large number of sellers competing with each other. Well, there's little price competition when you have markets with a large number of sellers. It just doesn't work. Often, if you have low volumes, providers can increase their charges just to maintain income. Rural areas frequently only have one doctor, one hospital. Inner cities may be close to hospitals, but that doesn't mean they can serve the people who are there. Talked about freedom to enter or leave a market. Well, that's hard to do in healthcare. Dr. Olson can't practice unless someone gives her a certificate that says you're licensed. Okay? And in the state of Michigan, that's not easy to get. You got to do a lot of training, have a lot of education. A lot of markets can be dominated by a very large system, and that could include an insurance system. In the state of Michigan, Blue Cross has over 70% of the business. You want to think they don't have an effect on price? You wonder, how does the healthcare market stack up in a free market economy? The answer to me is quite simple. It doesn't. Can we afford the time it would take for a free market to catch up and settle some of our problems? Everything I outlined about the fact where a market doesn't work can be turned around. We can give price and quality information to people. We can take down constraints on entry into a market. We can suggest that we got to bust up large systems so that we can have free markets. And the question is, do we have time to do that or not?
So if we do not have time, what's the alternative?
If you don't go with competition fully, then you have to worry about some form of regulation. Bad word in our society, but rationing, budgeting, mandating, controlling are words that enter into the discussion. We talk about an individual mandate, basically saying every individual in this country, whether employed or not, is going to be required to have insurance. If they can get it from their employer, fine. If they can afford it themselves, fine. If they can't afford it, it'll be subsidized. But every individual would be told, you must have insurance in order to live in this country. 2, every employer would be mandated to say, if you want to do business in this country, you must provide benefits for your employees as a condition of doing business. On either case, if you don't do it, we're going to tack on a penalty for you for not doing it. Is that fair or not? Can you mandate? You've already, 2/3 of you said, well, we're not too sure we want free enterprise, so one of the other sides is a mandate. Can we do that? Whoa, not so sure. Let me take it from one other angle now. If more people put money into the insurance system, would insurance work better? Because the whole idea of insurance is to have people put money in, even the cost out among everybody, so nobody gets real extremes. If we mandated in a regulatory way more money to go into the insurance system now, letting insurance work in a free market environment, would that be good or bad? More people think people ought to be in the insurance system. This is where you blend free enterprise with regulation.